We're so excited that Kathy is here to join us. I'll tell you a little bit about her. She joined the Berkeley Media Studies Group to help build the organizational and communications capacity of local health departments, government agencies, and community-based organizations working to advance equity. Prior to joining Berkeley Media Studies Group team, she spent 11 years at Alameda County Public Health Department, where she helped foster racial, social, and health equity through policy change, community partnerships, and building institutional and staff capacity within the health department and the county. And before moving to the Bay Area, Katherine supported local health departments through her position at NACCHO, the National Association of County and City Health Officials in Washington, D.C. She received her bachelor's in sociology and international studies from the University of Denver and her master's of public health and doctor of public health from the University of California, Berkeley. Her doctoral research is focused on how local health departments addressed and communicated about the foreclosure crisis as a driver of health inequities. So we're going to turn it over to Kathy. Thanks for being here.
Thank you, everyone. I'm very excited to be here. And thank you to Travis and Isa and everyone who's planned this. And I know I had a chance to look over just some of the folks who'd registered, working on everything from housing to domestic violence, food access, healthcare access, education, jobs, poverty, Black physicians of Utah. And I just think it's really powerful to be in a room where all of these sectors are coming together for a common goal. And so just honored to be here. I want to make this engaging. I'm not a morning person. So for those who aren't either, feel free to stand up. But we are going to try to make this engaging. I want folks to come out with really practical tools. I know you all are doing really critical, hard work. And so I want these tools to make your job easier, more effective. And I'm going to be asking for engagement along the way so that it's not just me talking. I think that will make it a lot more interesting. And yeah, as mentioned, I'm also from Colorado, so it's nice to be here. The mountains are on the wrong side for me. When I was driving, I was like, something's wrong. And I realized it was like, oh, okay, the mountains are in the wrong place. But it's nice. I feel like I'm speaking to a room of neighbors, so I appreciate that. And yeah, I think we'll just jump in. So what we do at Berkeley Media Studies Group, we started 30 years ago. My boss, Lori Dorfman and Larry Wallach, started the organization because there were many people doing the type of work you do, amazing work, critical work, and they weren't always that effective at communicating about it, especially in the news media, and really being able to speak in a way that people could understand outside of public health. And a lot of times we ask, if the issue you're really passionate about, the issue you really care about, if the only way people knew about it was from the news, what would they know and what wouldn't they know? And with a lot of our issues, there's a lot that would be missing. And so we really conduct media research. Many of you may have heard the term narratives. What are the narratives that shape what we see as possible, what we can even envision as a solution as society? And the media is often a proxy for those narratives because they influence a lot of decision makers. And so we really try to look at the media and see whose voices are missing, are there solutions, who's portrayed as responsible, what voices would we like to see in the news? And then we take that and we conduct trainings, things like this, technical assistance. Sometimes we do one-time things, sometimes we work with people for years and really try to help them pitch stories to the news. And then if we're working with advocates to help them get their voices out there, the other part of the equation is working with journalists. We'd like them to ask different questions that really get to the root of inequities and the solutions. And so we hope that by combining those things, we are shifting the narrative and having people understand a little bit more of the nuance of what impacts health and some of the solutions that are out there. So I want to share a little bit about myself, but this is going to go into what we're talking about today. And so I want you to listen. I'm going to be asking you some questions about my own personal story after I get through it, since we're talking about stories. So my parents grew up without a lot of financial stability. My dad's from North Dakota. My mom grew up in Virginia and Colorado. but they worked very hard and they were able to buy a house. My dad was a manual laborer. He worked at King Soopers as a butcher, and he worked hard so my sister and I could have opportunities that he and my mom didn't. Even in tough times, they were financially savvy and they kept food on the table and a roof over our heads. And this allowed me to push myself in school to do my best while also doing other activities like band, theater, things like that. And in my past and even now, I've had a lot of health issues, but I've still accomplished a lot. I'm actually a first-generation college student and worked really hard to get my doctorate at UC Berkeley. So that's one way to tell my story. It's all true, it's accurate, but it's not the full picture. It's a very narrow portrait view of my life, and it doesn't really tell the full story. So I'm going to tell it again, but I'm going to tell it a little differently. So yes, my parents grew up without a lot of financial stability, but my dad served during the Vietnam War. He got the Army bill, and he was able to that helped him buy his first house. I identify as white, as do my parents, so my dad didn't face a lot of the discrimination, redlining, which is when banks said different areas of town were not financially viable and refused to give loans there, or other policies that didn't limit where he could buy. That allowed him to accumulate wealth. So even on a manual labor job, that helped me go to college. And so, yeah, my dad was a manual laborer. He did work very hard, but his union helped ensure workers had good health insurance. I had a lot of ear infections, and when those are untreated, children develop learning disabilities because they're not able to hear the words when they're learning to read. And I also had migraines, and I was able to get these treated because we had health insurance, even with a manual labor job. And my parents were savvy, but they had access to a good credit union without a ton of fees. And when my dad would go on strike, the union offered some financial support. And my dad was able to get some stock options through his work. That's really helping them in their retirement right now. And I did push myself, but my publicly funded school was a working class area, but still a pretty good school. I had honors classes, I had band, I had theater, and there were other opportunities that were funded by taxpayer money and helped all of us explore, grow, thrive, find what we're passionate about, keep us interested in school, develop different skills. You know, I did a lot of theater, which is why I still get nervous speaking to rooms full of people, but not as nervous. And I have had health issues, but I've almost always had health insurance through my parents or through my work. I identify as white, and I've faced fewer barriers to getting those jobs that have health insurance. There was a period when I finished my doctorate and I was going full-time back at the county health department, and I had a gap and had pneumonia, and it was really scary. It was so precarious, but that was only a short moment in my life, not my whole life. And so that's really helped me overcome those health challenges. And I did work very hard. My doctorate was sort of grueling, but I attended a publicly funded graduate school. I qualified for work study. I had some of my student loans forgiven, and I received financial aid. And so now that's allowed me to gain skills that I'm trying to use in places like this to help other people. I wouldn't be here without all of these things. If any one of these things had shifted, my life might be very different than it is today. So that's also my story, and it's also true. And it's a little bit more nuanced about what really surrounded me that allowed me to be here in front of you today. All right, so Pamela is going to be using the mic, but and this is where we're going to start being interactive. I'm also very comfortable with silence, so I'll sit here until people respond. But I want to know, this is me as a baby, this is my parents. What are some of the portrait elements you heard in my story? What made it a narrow portrait story the first time around? Anyone? Okay.
As I'm thinking to your first time around, it was all about you and what you were able to do. And the second time around, it was how other people or other organizations or community allowed you to do those things that you said you were able to do.
Absolutely. And you got a little bit to the next part, the landscape elements. This is me and my dad a few years ago when King Soopers went on strike. He's retired, but we wanted to go support the workers. This is my elementary school. I also not very athletic, so parachute day was my favorite because no one was throwing dodgeballs at my head. And that's my library I grew up in. I was sort of nerdy. I was bullied a lot, but the library was a safe haven, for me. It was a place to explore, to dream big, to think about things that were outside of my town. What other landscape elements did people notice? Or what, anything you noticed about these stories? What was different? How did it resonate with you? How did it hit you? Over here?
Through publicly funded schools. So it just recognized a lot more privilege than the first story.
Absolutely. And that sometimes can be a hard thing to talk about. There's a lot of opportunities for white folks to sort of delve deep and figure out how we relate to our privilege. But sometimes naming it in a story and being explicit about it can be helpful, just acknowledging that things aren't balanced, things aren't fair. Any other things that people noticed? One more, great.
I noticed your mention of the military connection in your family, which can be a double-edged sword because having a military parent in the home can be a difficult thing to have to work around when you're a kid, but it does also come with some of those supports, like getting assistance to buy a house or having health care in the home that covers your family. And so that military piece that you added in kind of spoke to both sides of you having those privileges, but also having some really strong hidden challenges that some community they don't know about.
Yeah, such a good point. And that holds true for so many of our institutions. They can be helpful and they can be harmful. Even our public health institutions, public health has a checkered past. There's some amazing things we've done and then we've done harm, right? And so we can always be thinking about, when we're talking about the landscape, those are some of the nuances we can get into and think about if we're really honest about our stories and these elements. What are the benefits of this, and then what are some of the things that need to be repaired or fixed or acknowledged? Yeah, very good point. So this is going to be the crux of what we do today. We're really going to think about some of the landscape elements of the issues that you all work on, and we're going to do some activities around this. So there are benefits and challenges of using this perspective. The challenges can be overcome, so that's a sneak preview. My goal is that you all have some time to practice your landscape story today and think about how that connects to your work. And we really need to connect these landscape stories to other parts of a strong message, including values, which the values you presented in the beginning are such a great starting point. If you're ever stuck, those are things you can turn to in your messages. And, I just want to acknowledge that in the time we have today, there's so much more that can go into really communicating effectively. So this is just a snapshot, but I'm always happy to talk to people, help you find stuff on our website. We have a lot of resources on domestic violence, housing, food access. So if anyone's looking for those things, we have much more specific message guides on some of those issues. So, but before we get into the landscape messages, I'm going to spend a little bit of time talking about strategy because it's so essential. We get a lot of people who come to us and they're like, we want something to go viral on TikTok. And we say, why? Who are you trying to reach? Well, I don't know. We just want it out there. And I think because we live in such a fast-paced environment and we all, have access to these things, we focus on either the message or the medium. And if we don't really figure out what we want to do before we get there, sometimes we can put a lot of effort into those things and they're not that useful. So we always say, message is never first. That's lesson number 1. And before you know what you want to say, you have to know what you want to do. That is going to make the communication so much easier. This is also the place to start embedding equity. When you're thinking about what you want to do, if you don't have the people around the table who've been most harmed, your policies or your system change are probably not going to be as equity focused. So if you want to communicate about equity, you've got to build in time and space here, and maybe you need to slow down your process to be more inclusive, but this is really the foundation. Also, I should just note, You will get the slides after, so if I appreciate people are taking notes, but don't feel like you have to write down everything. We'll send the slides. So message is never first. How do we figure out what our strategy is? We can start to think about what do we want to change in the world, and we can think about how we want to change it, and why do you want it to be changed? So one example, it sounds like in Davis County, there's concern about suicides, and there's a movement to prevent suicides. And so what do we want to change here? One idea is to ensure county agencies are working together to prevent suicide. We all know sometimes county agencies can be siloed. Each agency has a little bit of a part, but if we worked more together, we'd actually be doing better work. So how do we want to change it? Partner with county leadership to adopt a countywide suicide prevention plan. And why do we want it to change? We could say as county workers and community partners, we can come together to prevent suicide and help our residents live healthy and fulfilling lives. So that's starting to get to our strategy. We could think about a harm reduction one. We want to limit overdoses and ideally end them. So we could make Narcan easily accessible in the places it's most needed to prevent overdoses. And maybe one idea would be installing Narcan vending machines, and we want elected officials to fund this. And we want it to be changed because everyone deserves a chance, all of our community members, to live and improve their lives. So those are some examples of how we start, and these are things you're working on already, but sometimes it's implicit. And if we make it explicit, it's easier to work in coalition because we are able to really be clear on what we're trying to do. So I did get a chance, I was able to look at some of the email addresses and look at the organizations you come from, so I have a little bit of sense of this, but I'd love to hear from about 3 people again. And this is an opportunity to practice good communication, so we're gonna be concise, not a paragraph, 1 or 2 sentences, but I wanna hear, what do you wanna change in the world? And I wanna hear from 3 people.
If you could speak into the mic since it's a recording,
Okay.
that would be great. And so I'm actually
All right. And this is an opportunity. Today is a great opportunity to network and connect. So maybe what you say will spark interest from someone else in the room.
So I work in our public schools over here. Sorry, and I would really want every student to feel a sense of belonging in their schools.
Beautiful. And it includes a value, which we'll get to later, belonging. Thank you. Other folks, what do you want to change in the world? Over here.
I'm from Davis4 Health, Inclusion and Diversity Coordinator. What do I want to change in the world? Our level of curiosity. Enter conversation, enter the room with curiosity first.
Great. Thank you. What else do people want to change? Let's get one more. All right, right in the back. Thank you. Thank you so much, Pamela.
So I work for our county Head Start program, and I oversee the health services for our program. I would love to see us not have disparities among some of our communities here.
Great. Thank you all. So we can already see that in the room, people know what they want to change. That's the first step. And so we can start to build on that. One of the tools, and we'll be sending out some resources, I think, after that we have linked up on our website. Our layers of strategy dives a little bit more into this idea of thinking about what we want to change. This is a one-page handout. I've used it many times with many groups. Some groups who've been meeting together for a long time, and they think they're all on the same page. Sometimes it's a new coalition. But even though it's just one page, it's a really fruitful discussion and really brings up a lot of space to think about, well, what does equity look like? And are we really on the right track? So our layers of strategy, the overall strategy is our goal. What do we want to change? Our media strategy, so this is set up, thinking about people wanting to use the media, but sometimes the media is not the right way to go. So the questions in the media level, we're not going to talk as much about today, but it can be tailored towards social media, or even how do we communicate within our own organization or our own health department. Do people want email? Do they want lunchtime meetings, where they can come and ask the director question? All of those things can fit into that area. We will talk about the message strategy today. Those are the words we choose, but again, we're not going to get there until we talk about overall strategy. And then access is, there's so much happening out there. How do you raise your equity issue up so it cuts through the chatter? And people open your email, or the reporter decides to cover your story, or your op-ed gets placed. And again, just to mention, we say this a lot. If you ever hear me speak again, I'll say the exact same thing. But you can't have a media strategy and you can't have a message strategy without an overall strategy. We can talk about these things hypothetically, theoretically, but if we really want to improve lives and address disparities, we need to have a strategy of how we're going to do that. So the overall strategy is the one level I'm going to talk a little bit about. Again, these are very simple things, but when you get a diverse group of people around the table, there's some really interesting discussions about, well, what is the problem and what is the solution? In public health and public health adjacent fields, we have a lot of data on the problem. That's where we spend most of our time. If you look at our reports, it's very problem focused. And so we typically don't have a hard time identifying the problem. But the rest of the things are not always what we're trained on in public health. We want to clarify the solutions, and we want to embed equity there. We want to think about who has the power to make the change that we think is needed to promote health and decrease disparities. And we want to think about allies that can help, especially, if we're in a position of power at the health department or a director of a nonprofit, thinking about who are the allies and how do we build the power of the folks who've been most harmed by our systems so that their voices are at the forefront. And then we want to think about what actions we'll start to take. So, I forgot that animation on that. Go through an example that we worked on at the beginning of the pandemic. People were very concerned. Housing is a key area, key issue in the Bay Area. It is very challenging, and a lot of people are already being displaced. And so there was a lot of concern about when people lost income because of COVID, how those evictions were going to ripple out and affect them. And so there was a lot of movement to pass equity-focused county eviction protections. In Solano County, they were really passing one of the most equity-focused ones. They really built into the actual policy equity language. And so again, building this in your strategy is critical. And they had a lot of people around the table who were able to bring equity into the solution. They definitely did not go it alone. They knew the Board of Supervisors was the group of people who could make the decision, and they also had done so much homework. They were very savvy. They knew that the board was generally supportive. And so this really shaped the other layers of strategy, because they weren't trying to shame them or put them on blast in the news, but they were trying to give them a little bit of political cover to do the right thing, because there was a little pushback. And so that changed the tone of their op-ed. And, it was like, you're on the right track. This is, Solano County's at the forefront, and keep going, keep doing this. This is the right thing for our community. And it also dictated where they decided to pitch their op-ed. So they were looking at, should we pitch it in a district where maybe the person's wavering, or should we pitch it in our champion's district? And they went with the champion because she was getting pushback. And they wanted, as allies, to build that rapport with their elected official and say, like, hey, if you do equity-focused legislation, we've got your back. We're going to help you. And so that they made that choice, and it was very easy to make that choice because they had done a lot of work on their strategy. They had legal groups, faith-based, housing, immigrant rights, public health organizations. In this example, the public health department was behind the scenes. They provided some data and research, but they were not the spokespeople out front. So, government agencies, public health departments don't always have to be out front. Sometimes they can really provide resources, again, so the people who are most impacted can be out front. And even though they felt pretty confident with their one-on-one meetings and homework that they had done that this would pass, it was so important that they did a lot to make sure it did. They had petitions, public comment, op-eds, social media, getting people to go. This was such a weird time. All of the meetings switched from being in person to Zoom, so that was new. So they were doing a lot of work to get people to show up on these Zoom meetings. And it passed, and it was one of the strongest eviction protections. And so this is an op-ed that we worked on with them. And again, a lot of times we fixate on, oh, we want to get an op-ed placed, but if we haven't done our strategy, then when we're trying to write the op-ed, we get very confused. Well, what are we trying to say, and who is it targeted to? They had done so much work. This was a last-minute thing. I think we started working on it at like 5 or 6 p.m. and we wrapped up by 11 p.m. and we pitched it the next morning and it got in. And so we wouldn't have been able to write it that quickly if they hadn't really honed in on their strategy. It just made all of the other decisions easier, and the messages sort of wrote themselves because they were very clear on what they wanted. And so another point about this is that, again, if you want to address racial and health inequities and you want to move towards racial and health equity, your overall strategy must center it. And sometimes we do need to slow down. We need to think about who's at our table. We need to think about, maybe this isn't the time to go straight to the media because we haven't done the work to build those partnerships or to really embed equity into what we're doing. And so it's, we don't, even though we're love to see stories in the news about these issues, sometimes it's better to wait. And that's an okay media strategy, is to wait until we know what we want to say and wait until we know what we want to do. If you build a communication strategy around racial and health equity and it's mismatched, your overall strategy doesn't include it, people will know, especially the people who've been most harmed. It won't ring true, and it's not going to build trust with those communities. So one example of really, again, of how embedding equity into the strategy then makes it easier to generate media or other communication strategies is another group we worked with, the Bay Area Regional Health Inequities Initiative, is very concerned about displacement in the Bay Area of Black families and the lack of ability for Black developers to get contracts. And so they've spent a long time building a coalition to really look at all aspects, from home ownership to renter protections to development of housing, and really create a package where they think that will help Black people stay in the Bay Area and help ensure that Black developers and others who are building housing get contracts. And so they spent so much time on this. Then when they were ready to do a press conference, it was very easy to get these equity messages into the news. This was on the front page of the San Francisco Chronicle. And like in the beginning when I mentioned that, we also try to do work with reporters. We've seen some pretty mediocre writing on housing where it doesn't get to the root causes. It doesn't explain why we're in this mess. But this article did, and it's because that everyone in this coalition was really on board, really in sync. They knew what they wanted, and the bulk of this piece really focused on the advocates' language rather than the opposition. And, we're always excited when we get the front page as well. So this is, again, a lot of time on the strategy. The press conference felt very fast, but it moved quickly because they had spent so much time prepping. So that's lesson one. I know I spent a lot of time on it, but I can't emphasize enough, like building a good, solid strategy, and your strategy may need to change, as you talk to more people. But that is the most critical part, and it seems like it's outside of communication, but it really is part of our narrative change, part of our communication work. So that's lesson one. Lesson two is make the landscape visible. This is the theme of today. This is what we're going to spend a lot of time on. And the reason we want to make the landscape visible is what surrounds us shapes us. So when I told my first story, I didn't talk about the landscape at all. And it seemed like I just did everything, or my family did everything by ourselves. When I told it the second time, I started to get into what surrounds us shapes us. What if my school hadn't had all those opportunities? What if my dad's job hadn't had health insurance? I'm very much shaped by these community level factors. And so we want to bring these landscape elements into our work. I think a lot of us understand it and we think about it daily, and we might use shorthand, we might use jargon, even equity can be jargon. And so then when we're speaking out to people outside of our circles, we don't connect the dots as much as we could. And so thinking explicitly about the landscape is a way to really make sure people hear the second type of story, not the first story I told. Here's another interactive part. I want to ask what people notice about these signs. It also gives me a chance to get water. What do you notice? Anyone? If not, I'm just going to have Pamela pick people. Or in the back over here.
The messages are contradictory to one another. If we're talking about not taking childhood obesity lightly, and then we're promoting ice cream and French fries and
Yep.
what some might say is like obese leading food.
Yeah, so the people we're trying to serve are getting a lot of mixed messages. And sometimes the budgets of the folks at places like McDonald's are much bigger than ours. And so, we're trying to do this work, but it's really tough going up against those type of budgets. What else do people notice over here?
Not only are they contradictory, but you see on the top it says food stamps can help, and the below billboard is advertising a dollar menu. So they're both kind of geared towards lower income folks, which as a result, those types of dollar menu, low quality foods are all that are available to that type of person in some instances.
Yep, and one more over here.
On the top one, the like doctor talking about obesity looks like she has like depression. And the lady down below is super happy about McDonald's. So if I want to be happy, I should eat McDonald's. If I want to be sad, I should try to take obesity seriously.
Yes, yeah. Yeah, public health can't be fun. And we have one more over here. Up front over here, sorry.
I think visibility, where they put it as a strategic place for people where there's a lot of traffic.
Yeah, so this is a real photo in Oakland. This is on the side of an apartment building. Who do we think lives in apartment buildings where there's zoning that allows billboards, right? We really start to think about the structural inequities. And that this is targeted to low-income folks. It's also targeted to people of color, right? Both of them are. And we know, and we've done a lot of work on targeted marketing of junk food, and we know that often, especially kids of color, are trendsetters. They are the first to pick up on something, and then it ripples out and makes profits for companies. So that's why they're so focused on targeting families of color and trying to get them to do this, because it will ripple out and make them more profits. So we have a lot to deal with in public health. It is challenging, and this is what we're up against: big budgets, the zoning laws that allow this, and the neighborhoods where kids are free from advertising are much different. And so when we think of health equity, it demands more than just education. We can tell people to eat healthy, but if this is the context they're living in, it's very challenging. What we'd probably see in that neighborhood too is that there's fewer food stores, and that really to get to a grocery store, people would probably have to ride a few buses. And that's just not possible for some folks. So when we think about equity, we have to reframe. We have to think about not just telling individuals to eat healthier, but thinking about what shapes us. And so I'm going to talk a little bit about framing. This is an interactive thing for everyone in the room. I'm going to go to the next slide, and everyone can just yell out as quickly as possible what you see, the words you see. Is everyone ready? All right. What do you see? Yeah, louder. Okay. You're all wrong. So what just happened there? Our minds took a few triggers and filled in the blanks. And framing is a survival technique. We have to do this. It's the way we've survived as a species. we're able to take a few cues of a plant and know whether it's poisonous or not. Back a long time ago. Now, I don't pull into a restaurant and ask if they have a gas pump, or I don't go to a clothing store and try to order food. I can take a few little cues. I'm even driving from the airport to my hotel. Like if I needed to get gas, I know where to get it just from I don't have to think about it. So framing's essential. And sometimes it gets disrupted. I'm like, wait, every time I see mountains, it means west, but now they're east. So my mind's filling that in, and if I lived here for a long time and had repetition, that framing would sort of change in my mind. But when we're talking about public health issues, a lot of times what our brains fill in, what the public's brains fill in, is not helpful. And it contains stereotypes, it blames individuals, it defaults to individual personal responsibility, and it ignores a lot of the context. And so this is a challenge. We have to repeat a lot. We really have to emphasize this because we are going against some of the default ways that our brains think. Cognitive frames are mental pathways that help people understand the world, and on their own, they're not bad. But when they contain a lot of stereotypes or they don't allow us to envision equity solutions that really promote the health of our communities, this is something we have to contend with. It's like the groove in the snow, like when it's entrenched, when I really think the mountains are on the west, it's going to take a lot of repetition for me to switch that framing. And so that is our job in public health with our messages. We can always think about, how do we move to the landscape? How do we change what people think is behind that orange box? Another reason we have to do this is often, again, I mentioned public health, we have a lot of data. And we often lead with data. But if we don't put context around the data, we can actually do damage. So we have a lot of statistics like this across issues. Infant mortality rate is highest for Black women, double the rate of white women. To us, we may see this as an injustice, and we may think that if we say this to a reporter, or if it's the lead sentence in a report, people are just going to get, we gotta fix this. But we don't know what our audience is filling in behind that orange box. And what we do know is that, unfortunately, in our society, what they may be filling in is, there's something wrong with Black women, they need to do better. And so if we're public health workers, we do not want to be sending that message. And so even having a sentence before or after that data that has some of the landscape will help move people to something behind that orange box that we want, instead of them filling in the blanks with something that's actually damaging. So what do people fill in? The default frames or narratives in our society: personal responsibility. Every issue that people have registered here: housing, domestic violence, food, healthcare access, education, jobs, poverty. I can guarantee that if you look in the news, you're going to see personal responsibility stories. It's going to be about one tenant trying to change their life, one person with diabetes who's lost weight, one person who, grew up in poverty but defied the odds. It's not going to be very reflective of systemic and shared responsibility. So again, if this were easy, we would have done it already. And kudos to everyone in this room, because this is hard work, to tip these scales, to help people see the shared responsibility. But I also think it is exciting that everyone is in this room together, because imagine if all of you were reiterating this story every time you got that chance. There's a lot of people in here, and if you build that shared responsibility story, we would start to see things shift. And so there's a lot of opportunity. So when we're talking about the landscape, again, and this can be a helpful metaphor in thinking about what you're putting out, how you're communicating. In this, we see the portrait, a kid struggling in school, and maybe the solution, for educators, if you saw this, it might just be like, well, that kid needs to try harder. Maybe there's something that kid's not doing. But if we look at a landscape, we could see here is a crowded classroom. Some of the desks have 2 kids per classroom, per table. And then if we tell this landscape story, some of our equity solutions make a lot more sense. If I'm just showing this, and I'm showing this kid having a problem, and I say, but we need more funding, we need more teachers, we need to build more schools, or we need more after-school programs, that's not going to make sense, because it looks like it's just this kid's fault. But if I show this as the problem, then those equity solutions start to make more sense. Another way to think about the portrait is it's episodic. It's a snapshot. It doesn't tell the whole story. And it's really focused on personal responsibility. The idea is you're on your own. If you have a health issue, you're really on your own. And there's people who've overcome their health issues. So if you can't, it's probably your fault. That's sort of what we see. And there's a duty to family, which is important, but it sort of stops there, like people protecting their family. And there's an idea that, the market will fix everything, that, we just leave it up to market forces and that's what's most important. If we move to the landscape, that's more thematic. We might be able to explain not just why one tenant is worried about getting evicted, but what is the history that created this housing landscape, and why do we have so many tenants in this position? We might get to shared responsibility. We talk about it, we're in this together. It's the yo-yos, you're on your own, versus the wits, we're in it together. And instead of just duty to the family, which is important, but we can broaden that to duty to the collective good. And those are values that people hold. The same people who might at first seem opposed to equity initiatives might be the same people who would have done a barn raising or helped their neighbor or contributed to a GoFundMe. People have cognitive dissonance. They hold different values. And so if we can trigger the landscape, they might be more supportive. And instead of just looking at market justice as the solution, we can look to social justice. And so storytelling is one of the big buzzwords out there, and we love storytelling. We think stories are very powerful. Our brains are wired in popular culture, in media, even the myths and fairy tales that have been around for centuries. Our brains love those stories. They actually have done research and different parts of our brains light up. But the challenge with storytelling is often there's a hero story. Someone was able to beat the odds. And we think it's inspiring, but what it can do is obscure that these odds are stacked against many people, and it can reinforce, well, if one person, this hero, beat the odds, why can't everyone? And so we want to really change this story to our leaders must change the odds. So from beating the odds to changing the odds and create healthy environments so everyone can be healthy. And again, this is challenging. It's not going to happen with one story, one report, but if we have this as our long-term goal, we can keep building to this in everything we do. So how do we make the landscape visible? So that was sort of like big picture theoretical. These are going to be some of the nuts and bolts. We'll have some examples for them too. So we can bring history forward. We can use a few facts and data points. People tend to drown out data. So we wouldn't want an op-ed that's just data, 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 but being judicious and choosing one or two really key points in that op-ed or in your website or your social media post can be compelling when it's connected to other parts of a message. We can describe systemic solutions that help more than one person. We can name social factors or root causes. Again, one mention of this is not going to change everything. It's going to take a lot of repetition. And there's so many social factors that affect this. Again, why having everyone in the room is so important. Some of you may choose to talk about the history of transit and how it's hard for people to get to their appointments. Others may talk about the history of housing. Other people might talk about, healthcare access issues. So all of that's building in a landscape that helps people understand the social factors that affect us. We can support, we call people who have lived experience, authentic voices. Often are some of the most powerful voices in sharing their story, but again, we want to help them connect that portrait to a landscape, and we can use compelling visuals. Sorry, I'm just going to take one sip of water. So I wanted to provide some examples of what this can look like in practice. This is from when I was at Alameda County. This is sort of an old report now, 2008. It was released with the video series on natural causes, and we wanted to really do a report that focused in on the social factors. So there were chapters on education, on housing, on food access, and each chapter had policy solutions, and that's how we started building relationships with sectors outside of public health. We had people review the sections and the policy solutions, and then they'd say, oh, we didn't know the health department was working on this. Can you come testify at this meeting? So it was a way to build our capacity. But from a communication standpoint, we started each chapter with a quote and a historical overview. And a lot of the people we were speaking to knew this. It wasn't news to them, but it was different for a health department to be talking about Brown versus Board of Education. And it was being very explicit about why a public health department was trying to rectify some of these past injustices that still impact the communities we serve. And we felt very strongly that we could not achieve our mission of optimal health and well-being for all people if we weren't acknowledging these things. And so this was just one way that we brought history forward. We can name root causes, how things came to be, and show the landscape. This is from a deputy health officer in San Mateo, and he's talking about birth and infant health, and he names lifelong experiences of racial discrimination and the policies that create inequitable neighborhoods and socioeconomic conditions are causing toxic stress that impact birth and infant health. So he's starting to name this. This was in the news. If we had more time to work on this, I would say like socioeconomic conditions is a little bit of jargon, and inequitable neighborhoods. It'd be great if we could show what that means. But this, he's at least getting some of the root causes into the news. How many people have heard of or work on ACEs, adverse childhood events? Great. We have a lot of resources on ACEs too. So absolutely important for those who haven't worked on them, adverse childhood experiences. We know that things like physical abuse or neglect, sexual abuse, emotional abuse, a parent or caregiver treated violently, all of these have long-term impacts. And we can look at how many ACEs a child has and think about how we try to provide some supports to ameliorate those impacts. But that is still at a portrait level, and we're really focused on individual intervention. We can include the community context, and these are adverse community experiences. So when we have concentrated poverty and economic instability, we know violence in the home goes up, right? And so we compare these things together. We might have individual interventions, but we also might have a lot of compelling stories from our work about how it's really hard to address some of these things when people don't have access to economic stability or housing or parks and green spaces. And so it's not an either or, but it's a both and. How do we bring in both parts when we're talking about our work? And here's an example of a reporter using a few facts to show how something impacts more than one person. So reporters are always going to want a portrait. They are never going to want to start with the landscape story. And so we can prep that. We can give them compelling spokespeople, but the spokespeople or information or handouts that help move to the landscape. And the reason they want to start with a portrait is that's what, again, lights up our brains. That's what people read. And so this person, she, during the Super Bowl, she's pouring $18 beers, but only makes $14.25 an hour and has no health insurance. And the reporter says, Walker's plight is not unique. About 2,300 workers will be serving hot dogs, mixing cocktails, and scrubbing toilets on Sundays. And so this is, if we just heard about this one person, maybe we would say, well, she should, work harder and get a better job. But when we realize it's 2,300 people, it's like, okay, we probably need to do something systemic about this. We can also support authentic voices in connecting their story to the landscape. So there's in rural areas of California, contaminated drinking water. And this woman is frustrated because a bill was passed, but it's not been implemented. And so, people have said, why don't you just move? And this is a great quote, very succinct, but she says, that's not the solution. If I leave, another family will just come here and have the same issue. And so she's connecting her struggle to other struggles. And when she does that, it makes it harder to just focus on individual responsibility. It puts it back on, well, what is the state of California's responsibility to ensure people have safe drinking water? And then finally, compelling visuals that show a landscape. This visual shows a solution that's happening. And we also know from analysis of the news that most often people of color are portrayed in crime stories and often as perpetrators, even though the data do not reflect that this accurately. If we would see a lot more white folks committing crimes in the news if it was accurate to the data. And so I really love this because when we're talking about community power to address equity, we need these stories that show joy, that show agency, that show power from communities of color who have come together to get a minimum wage for Uber and Lyft drivers. And so this is sort of challenging our narratives on multiple ways. It's showing that we can solve these issues. It's using a visual to show the landscape, and it's showing community power in action. So it's one I really like. So that's lesson 2. It's about, so we've talked about strategy, now we've talked about landscape. And another component that's really important in building out the landscape is articulating your values. Again, this is why I think it's so great that you have these values, and that's the first place I would turn to if I was stuck and talking to a reporter and didn't know what value I wanted to use. So again, our brains, we think data moves folks. There was actually a study done on crime stories where all of the data remained the same, but they used a different metaphor. They either talked about crime as a beast or crime as a plague. And across all different participants, when they talked about crime as a beast and they asked about solutions, people said, we need more punitive measures. We need more anti-crime laws. When they talked about crime as a plague on our cities, people were much more supportive of youth programs, after-school programs, things that helped people get out of poverty. And when they asked the participants, well, what made you decide this? They said, the data. The data remained the same. The metaphors change, the values change. And so we think we're really logical, but the studies of our cognition and our human brains show that all of us are not, including us in this room. So values help open us up at our heart level so that our heads can then hear that part about data. And so it's not either or, it's not that we leave the data out, but we want to think about what values we surround that data in. So things like community, fairness, interconnection, democracy, liberty, unity, family, can-do spirit. We've gone through hard things before, but we've overcome and we can do it again. All of those are things that we could include in our messages. Even if we're not talking to the media, we could include this in an email subject. Like we could say, come to our forum on aging, or we could say, our elders are a valuable part of our community. Join us for our aging forum. Maybe, it's not going to solve everything, but maybe more people will open up that email. Maybe they'll be more excited about joining into our initiative. So a lot of the initial research on values came from George Lakoff. He's a cognitive linguist. He talks about these levels, very aptly named level 1, 2, or 3. This I found very helpful when I worked with at the health department. So level 1, when we're talking about messages, we want foundational values like justice, unity, or interconnectedness. We want to start there, especially if we're talking to people who don't understand our issue. I was just on a call with a lot of legal folks, and they jumped in at sort of the detailed level, and honestly, I didn't understand what they were talking about. I'm not a lawyer. So I was like, wait, what is the big picture? What's really going on here? Level 2 might be, are we talking about evictions as a housing issue, or are we talking about it as a health issue? And we could talk about it as either, but it's a strategic decision about what we want to do. Are we talking about parks as an environmental justice issue, or are we talking about it as a health issue? Are we trying to incorporate a few? And then level 3 is what we call the policy plumbing, or the details. And it's absolutely essential to have the level 3 information, but that is not where we want to start our message. People tune out. It was the same when I was on that legal call. They just dove into the details of a Supreme Court case without a framing sentence of level 1. And I'm like, I don't know what's important here, and I'm having a hard time understanding my role. So starting with level 1 helps people see why they want to listen to the rest of the information. And when I was at the health department, a lot of times we were moving quickly, trying to get something out. This became a really good shorthand, like, oh, I'm seeing a lot of level 3. I think we need to get some level 1 in there. So this might be a helpful way to incorporate some of this into your work. What this can look like in practice, it doesn't have to necessarily be lengthy, but we worked with, now they're called the Central California Public Health Consortium. At the time, it was the San Joaquin Valley Public Health Consortium. Rural area, a lot of poverty, a lot of challenges. often portrayed negatively in the news. They're often last on different indicators, health, education, air pollution. And, they really wanted to emphasize the good things, the strengths and the assets of the community. And so the start of their report, instead of starting with the problem, they talked about the diversity, commitment, ingenuity, and resiliency of the region's people have carried them through decades of hardship and adversity and make the valley a unique and valuable place to live for many. So this is a can-do spirit. People have overcome hardship, and it's pride of place. So, a lot of times, if we're trying to get something passed, we can compare our county to other counties and say, well, they're doing it, or we'll be the first. And pride of place can be a very powerful value. Another example around public schools, no matter what we look like, where we live, or what's in our wallets, most of us want our neighborhood public schools to inspire imagination, cultivate critical thinking, and ensure our children can live fulfilling lives. This is something that a lot of us could agree on. We want what's best for our children. What the solution is, we might disagree on, but we can at least start here, and people might be more open to hearing that solution. So that is really, bring a few examples. We could spend all day talking about values, but this is really what drives our message strategy. So when we know what we want to do at the overall strategy level, then we go into our message strategy. And so this is another, I know I'm giving a lot of different frameworks, but if you can remember the components of a message, it's what's wrong, the problem, why does it matter, the values, and who should do what by when, the solution. And again, in public health, most of our messages are generally around the problem. We don't give people many solutions or many values. And this can make it hard for us to get our point across. People can tune us out because they're like, oh, I've heard this problem before, or there's too many problems. The news is so depressing. So when we talk about values and solutions, we don't want to minimize the problem, and they're very real problems. But when we start with a value or start with a solution, we might get people more excited to work with us or to actually believe that we can make change. I have a lot of message examples. I'm just checking time. I might speed through these a little because you will get them in the PowerPoint and you can use them to think about how you might include some of this in your own messages. But this is an example. What's wrong? There's no adequate places for children to play. Why does it matter? It endangers the health of the next generation. Our children need to grow up strong and healthy. What should be done? City leaders must make our proposal a top priority as it moves forward with the development of a general plan. So this is sort of linear. You don't have to put them in these orders, though. This is another example. So this is about housing, and this was in the news. A Rhodes Scholar was asked about his journey from public housing, and you could see the problem is sort of minimal, and the solution is much more part of this article. And he spoke about this very succinctly. He said, "Don't be happy for me that I overcame these barriers. Be mad that they exist in the first place." So 1 or 2 sentences, he's expanding to the landscape. This article could really just focus on that portrait. Someone who grew up in poverty, beat the odds, and my gosh, they're a Rhodes Scholar. Isn't that inspiring? He took control of the narrative, and my guess is he knew he didn't want the story just to be about him. He wanted to use it as an opportunity to talk about not just overcoming the odds, but why we need to change those odds for everyone. And so to expect resilience without justice is simply to indifferently accept the status quo. So, really weaving in the value of justice there too. We have a food justice example. I'll just leave these in here for you to look at. So some of the ones I've given are about policy or systems change. This is one that is, you can still use it when you're talking about individual behavior. So this is a COVID vaccine example. Native youth are doing their part in protecting our most vulnerable, our elders, from getting COVID-19. So they start with a solution, and then they go into our youth can do their part to protect elders by taking safety measures and getting vaccinated. Then they talk about some of the values. It's important for us to protect their elders because we are their lineage. They are the reason we're here today. And then they talk a little bit about the problem. COVID cases are rising. And so then back to the solution. It's critical we continue to wear our mask, wash our hands, and stay 6 feet apart. And I love this one because it is very succinct, but they pack a lot in here, a lot of values about intergenerational care, about community, about how we're all connected, and sort of weaving together a lot of these things that show that youth can be part of the solution when oftentimes youth are portrayed as a problem. And so I just think it's a really beautiful short quote, and it shows that we can also do this around individual behavior. Also, another example on healthcare, I love the first line. Despite our unique walks of life, the string that holds us together is the ability to care and love. And so that is a way to start. And then definitely we can go into the problem, we can go into some of the data, we can go into other things like that, but really queuing up sort of the best parts of ourselves. Like I said, we have cognitive dissonance. And so we want to queue up the part of people that care and are willing to consider different solutions that lead us to equity. So we've talked about strategy, starting with strategy. We've talked about how that allows us to expand the landscape. We've talked about values and the components of a message. And I really just quickly want to go through one other lesson. And this is something we get asked a lot. Sometimes we worked with counties where they're not allowed to use the word equity from their elected officials. But even in counties where they are, a lot of people don't know what that word means. They think of home equity. It's sort of jargon. It's great that we use it. We're at an equity summit. Of course, we are defining it, and it's sort of backstage language for us. But if we get an opportunity to speak outside of our public health sector, we may want to think about another way of saying what equity is. And this we talk about show, not tell. So what do I mean by this? I could say furniture. And you all sort of know what I mean, but it's not very specific. But I could say chair, that's getting more specific. I could also say soft, comfortable chair in the sunlight where I read my book in the afternoon, right? You're getting a much better picture of what's in my mind. And so when we are talking about show, not tell, we're talking about not labeling stuff, but giving people concrete examples of what we're talking about, making equity concrete, showing people what it will look like when we achieve it and that it's better for everyone. So we could say health equity, but if I were talking to a reporter, I might say something about like, we want our county to be a healthy and safe, vibrant place for everyone, yet some of us face barriers to this. I haven't used the word equity, but I'm starting to show what it is. We could also say we want our county to be a healthy, safe, and vibrant place for everyone. This means that our residents have access to good jobs with dignity, quality schools and housing, reliable ways to get from place to place, and clean air to breathe. So getting much more specific, and people are starting to see, well, what would it take to get there? And all of a sudden it provides an opening for the landscape and the solution. Well, what does it take to get good jobs with dignity? Maybe we need to pass a budget for more Job Corps training, things like that. And this is one of the challenges. So you can see health equity is very short, 2 words. If you're tweeting, much easier. But if you are, wanting to put this third example in, there's a lot of words in there. So we are giving you some challenging advice. We're saying be concise, be succinct, but also, try to show, not tell. And that's a tension. And that's why we need to build in opportunities for communication to be part of our agenda. If someone's creating this alone, it's tough. You're like, well, what should I do? But if you're able to bounce ideas off of people, if you build it into your coalition or your team meetings and create spaces where people can bring this up and say, I want to see how this lands. Can somebody tell me? There is such good opportunity to both show, not tell, but also, to work to make it concise. And it does take work. It's not something we can do, very quickly. So we need to build it in. This is another example. This is my former boss, Dr. Tony Eiton. Our county manufactures social vulnerability through policy violence. Then he goes on to say, that's sort of a jargon term too, like a lot of people don't know what that is. So he goes on to say, large segments of our society are experiencing constant daily stress as they try to navigate a healthy life without health insurance, without decent housing, affordable childcare, paid sick leave, or quality education. So he's really showing what we mean by policy violence. introducing a term that he thinks is important, but giving people concrete examples of what it is. So those are really the 4 lessons of today. We want to embed equity into our overall strategy. We want to reframe to make the landscape visible. We want to articulate our values, and we want to use the components of a message, the value, solution, and the problem. And we want to do it all with clear, simple language that shows, not tell. So that's a lot. That takes a lot of work. And, this is why I think it's great that people are here together. Now you'll have all these tools. Everyone here is an asset. Communication is something we all do. It's not, something that one person holds all the power of. So all of us are communicators, and all of us can go to a colleague in this room now and say, can you hear the landscape when I speak? Or do you think I'm using clear, simple language? Do you hear the solution when I speak? Or can you tell what my value is? And we can get feedback. So I hope these tools are helpful. What I want to go to next is I want to have us practice. So you all saw my story in the beginning. We have this handout in your folders. And what we're going to do, I'm going to give you a few minutes. Think about an issue you care about. It could be what you work on, or maybe something you're passionate about in your volunteer time. Maybe it's housing or child welfare. You can think about your role. You're a healthcare worker, you're a tenant, you're a mother, you're a grandfather. You can think about how the issues harmed you or someone you love at a portrait level and why you care about it. The next part is then thinking about the landscape, and these are the message components, the problem, why it matters, and the solution. So from your point of view, what caused this problem? And you're not going to be able to bring in every element of the landscape, especially I'm not going to give you much time. So you got to choose one or two. Might be history, might be policies. You really want to get your values in there. Why does it matter? And if you can, get the solution in. And maybe you didn't come here today with a concrete solution. So for today, you can think of a hypothetical one. And then you're going to put it on the back and really try to put it together. And thinking that you have 2 minutes to talk to an elected official or a reporter. And so I'm going to take off my watch. So I'm only going to give you 3 minutes to work on your story, not long. But that's okay. This is just the start. So we're going to start now. We'll go till 10:19. So I think because of time, we're not going to debrief with partners. But I wondered if and we're only going to do one person, but is there one person who would want to share their story, their landscape story? This is an opportunity. All these people here care about equity. They care about the work you do. So it's an opportunity to practice in a very safe environment with people who are aligned. All right, we have one over here. And see if you can listen for the things we talked about, if there's landscape or values.
So I wanted to kind of go off of like the healthy food and the billboard that we saw where this, anyway, we all saw it. So a lot of kids have obesity, diabetes, like high cholesterol, and they're in hyperlipidemia. There's so many things that have happened and that they go in and our healthcare system is a lot higher. Our kids aren't getting out and doing the things they need to help their community grow and stay healthy. So to help this Detroit or other places that don't have access to grocery stores, and then they put these grocery stores in and they get broken into, they get vandalized, and they can't keep that open and keep business thriving. So for helping kids to thrive and help them to get to know vegetables and understand like what healthy eating is, and to help them, I thought like a vegetable cart, like you have a hot dog cart and you go into these communities and you're able to have apples and oranges and things that they can just buy off this cart and help bring it into these communities and these where these kids have never been exposed or not have the opportunity, not have to bus to get these vegetables that they should have. And then growing these vegetables in growth lots or places that are no longer viable and they have empty lots, they could do like a community growth lot and allow people to come in and pick vegetables, grow vegetables, and just get that open and help them to know like where their food comes from. And then hydroponic is something that they can put in the schools and help these teachers know how to grow healthy vegetables again and help them to know like where their food source comes from and just basically healthy and help our obesity community and different things to squash that.
Thank you so much. And I know it's tough to speak in front of everyone. So many good things in there, a lot on the solution, like very concrete solutions, and really explaining the context and some of the landscape and why we need these landscape solutions. I'd love to hear, at another time, like more of your personal connection. You could bring in your story, as a healthcare worker. I try to help individual families, but I realize we also need to change the school environment. Or ways you could start to tie that together. I think we have time. We have one more. You were interested up here? Okay, we'll just do one more and then I'll have like a minute or two for questions.
Hi, my perspective from this is I am a mental health therapist. I have we have a space in our country where if you're on Medicaid, you can get mental health care. And if you have a good job with insurance, you can get mental health care. But for some of our clients, my clients especially, when they decide they want to get a new car, so they get a job, and they make 10 cents more than Medicaid says they're allowed to, they lose all of their benefits. They lose their food stamps, they lose their housing, they lose everything. Say their kid wants to go on the field trip. Mom and dad are trying to be really good about it. Go get a job. Kid gets a job, household income comes up, and everybody in the household loses their mental health care. The solution that I can see for it is like a step down for Medicaid, where it's if you make 10 cents more, we're going to take 10 cents off, not all of it. If you make $50 more, $100 more, and to the point where you would have coverage without having that gap of now what do I do? Many of my clients walk around Davis County with partially completed health care and mental health care because of the Medicaid going, that was a dime too much, sorry.
Great job. Thank you. So absolutely heard your role as a mental health worker. I heard the stories of your clients, but you moved it to the portrait. You landed on a solid solution that could be a little bit hard to explain, but you did so much show, not tell. You helped us understand. You really built to like, oh, this solution's common sense. Like with all you presented, what other solution would make sense? You really showed us how it would help you, it would help your clients, and it makes sense. So great job. So I know that was very quick. I had some questions, what was easy about this, what was hard. I'm curious what steps you could take to incorporate this into your work. Also wanted to open up for questions, and my contact information is on here. But we have just like 2 minutes. So a question or what was hard or easy about this? I'd love to hear how people might use this. Okay, we have one in here. Thank you.
Hi, I am passionate about peer support, and I currently help people with Medicaid and Obamacare. And I had never thought, like, while doing a presentation, to share part of my story about why healthcare is so important to me, about the time that I didn't have healthcare. But yeah, I'm so passionate about sharing your story about mental health and recovery and stuff like that. So it was very useful for me, and I'm excited to share with my team.
Thank you. I love that. And yeah, I maybe after in the break, I can hear your story. I'm sure it's very powerful, and I'm sure it will help move other people. When we speak from our heart and our own journey, it can be really what helps people take a different perspective, gets them out of that groove in the snow. Thank you. 1 minute. Anything else? Last words, questions, how you might use this? Everyone's ready to go to break. Any questions?
Just feedback. Just thank you for just the storytelling aspect and messaging aspect, because I had opportunity to work in a lot of different agencies and groups, and sometimes that messaging gets lost, and the why and the reasoning and who you're trying to talk to. Those are really critical pieces. So thank you.
Thank you. Yeah, and a lot of times it's in our brains, but we're moving so fast. We have so much work on our plate. It can be easy to not make it explicit. We all know all this stuff. Like, I'm probably not telling you anything new, but trying to give you tools to help slow down so that when we're moving fast, we can say, oh, wait a minute. We need a level 1. We need to start out with level 1 before we dive into this. So yeah, thank you. Well, I will be sticking around, and just thank you for all the work you do. I love to hear back from people if they use it, to see examples. My email's on here, and very honored again to be with you all today, and just wishing you all a lot of luck on your path forward.